there's so many other great benefits of fasting that we never really expected to happen. Anxiety, depression, like people that are really struggling with these chronic sort of mental health issues, it's just going away. I was someone who always struggled with generalized anxiety disorder, but with fasting, everything's clear, ADHD on that note too. Even myself, like I used to pop Adderall and Vyvanse just to sort of get through daily life. As prescribed by my doctor, I had no issues with it, but like I needed it. It was a crutch. And then suddenly I'm fasting and I'm so busy with work and I'm able to catch up on life for the first time in what felt like 100 years. And I just didn't have time to go to the doctor to renew my prescription. And there I was, blasting away through really complicated things without needing ADHD medication. And I couldn't even do really interesting things that I enjoyed without it in the past because I didn't have that ability to focus. I had so much carb brain all of the time that there was no mental clarity, and all of that came back with fasting. So we hear all of these,
I thought that was interesting what you said about mental health, because I certainly can relate to what you said about mental clarity while fasting and stuff like that. But to me, when I talk about, people can probably get some improvement in depression or anxiety, to me, it's kind of theoretical because I haven't like really seen it, up close, so to speak. But can you elaborate just a little bit more on like what you've kind of observed in terms of mental health issues with your patients?
It's fasting is a really great tool. First of all, so many of these medications that people use to help them. Well, there's a lot of controversy around them, but in general, they do contribute to insulin resistance. So we've actually collaborated with a team in Toronto with a group of patients with schizophrenia, because the primary medication that they would be on would cause extreme weight gain, extreme insulin resistance, diabetes, and then there's need for more medication, and medication compliance already isn't that high. And then to change the diet of these individuals can be very complex in nature. But fasting you can make into a game. Fasting simplifies things for many individuals, and therefore it's sustainable. So we've been able to help so many of these individuals, first and foremost, who are on these medications, sort of be able to counteract the negative side effects in terms of insulin resistance and weight gain. So just in general, it's positive for that. But there's just been patient after patient or individual in our community saying, this debilitating anxiety, this, seasonal depression, all of it is just gone. It's not there anymore. They don't have it weighing on them. They're able to come off of these medications that were perhaps making them feel a little bit numb, and they're able to feel things the way that they wanted to feel them again and have these experiences, but without the struggles anymore. And we attribute that to a few factors. Many people don't realize this, but our gut is like our second brain, and so many of our neurotransmitters are largely manufactured in our gut. So when we're eating sort of the standard North American diet, and we're eating lots of this refined and processed fake foods, and then we're just eating them all of the time, that really damages our gut. And so we're constantly, sort of giving our second brain, a punch and just beating it up, nonstop throughout the day. And that has a profound impact on us. And then when we fast, we're actually giving the gut a chance to heal. We're first of all giving the whole digestive tract a big break. But there's actually sort of these quote unquote fasting microbes that are produced in a fasted state that just help tidy things up and help you get rid of some of the bad bacteria and get some of the good bacteria, and just allow for the integrity of the gut to repair itself from having that rest. We tend to end up with these little leaks in our gut, and we don't end up absorbing nutrients very well, or food doesn't get properly digested. So the way it ends up leaking kind of out of our gut in this substance that's toxic, and we have this immune response to it. So we allow the gut to actually heal itself. We call it leaky gut syndrome, and it gets a chance to heal. And then this way, we don't leak out stuff that's potentially toxic, and we get to absorb nutrients that are much better. And so many people, too, that are battling anxiety and depression, there's nutrient deficiencies. But we're not seeing that happen anymore because we're allowing the gut to heal, and we're able to absorb nutrients much better. And then most people who do fast do some sort of complementary real whole food approach, whether it's low carb or paleo or ketogenic or carnivore is popular. But there are people that do a real whole food base that's more plant style and do well too, depending on their own body's physiology, what's working best for them. And that just further enhances the restoration of the gut as well. So we're really, when we're fasting and we're making positive changes with our diets, we're allowing that second brain to heal and to start to function optimally, and our body to get some of these awesome neurotransmitters that maybe haven't been produced or produced properly or in the right quantities or ratios. And it gives us a chance to really allow healing to happen.
Yeah, wow. So I was already going to say perhaps that it's probably multifactorial, but then you covered a lot of the stuff I was kind of thinking about. So you've got the medication, some of the mental health or psychiatric medications can cause weight gain or cause insulin resistance. And then you've got, well, all that stuff with the gut, if it's inflamed and if, bacteria is leaking out of the intestines because of certain types of food people are eating or just other general health issues, that has a bunch of effects, general inflammation and things. There's the flora or the bacteria that live inside our gut, that anything that affects them kind of affects our mental health and our overall health indirectly. And so there's all these different things. So there is a lot that goes into it. And maybe when people start moving in the right direction, they probably have a little more sense of control as well. And that just kind of helps, with general mental health and anxiety and things like that, I think. And in some cases, because they drop off some weight, maybe they're able to exercise more, and then that starts having some positive benefits. So there's probably a whole bunch of things that go into it. But yeah, that's pretty cool to hear. And then it reminds me of Dr. Georgia. Is it Edie or Ede? Dr. Georgia Edie. She's what was that?
Georgia Ede. She's phenomenal.
Yeah, she's done some lectures about specific dietary components that can kind of affect mental health. So it's not really about fasting, but it's related because it's might have some of the same effects indirectly in terms of the specific types of food that might be better to avoid because they cause certain types of inflammation in the gut and in general and so forth. So that's pretty cool.